Hi, my name is Dr. Wes, and today we're going to discuss ADHD predominantly in attentive. That is the type of ADHD, that is the disease mechanism in which different regions of the brain and neurotransmitter are involved. The regions that are dominantly involved are prefrontal cortex and basal ganglia, and the neurotransmitters are the catecholamines and dopamine. What is ADHD predominantly in attentive presentation is clinical description: patient is often quiet, distracted, forgetful, disorganized. Typical function impairment: academic underachievement, poor time management, incomplete assignments, low confidence. Key distinctions: hyperactivity and impulsivity may be minimal or absent, especially in adolescents and adults. Neuron mechanism: there are two major regions through which these disease progress: the prefrontal cortex and basal ganglia in striatum region. That is the neural mechanism in which there is a fault of these aspects of different regions. Attention drifts away from goal before the task is completed. Neurotransmitters in mechanism: dopamine and norepinephrine. Weak catecholamine signaling causes distractibility, forgetfulness, poor working memory. Medication logic stimulants and selected non-stimulants increase catecholamine tone, so to improve executive control. The symptoms: careless, mistakes, misses details, poor follow-up, lose item needed for task. The careless mistakes might causes difficulty sustaining attention, while poor follow through, poor organization and time management, and loses item needed for task, is easily distracted by stimuli or thoughts. The careless mistakes in which the people thought that the patient is not listening. Poor follow through in which the patient or the children or student avoid tasks requiring to sustained efforts, and loses item needed for task. There is a condition of forgetfulness in daily activities. The patient may look quite lazy or daydreaming, but core issue is impaired attention regulation. Diagnosis: history, rating scale, rule out mimics, and comorbidity or comorbid condition. That is the diagnostic essentials. Symptoms arise before the age of 12. Several symptoms in two or more settings. Clear impairment in functioning. That is the best practice note. Treatment: a multimodal plan, behavioral and educational support from the teachers and the parents. The stimulant medication, methylphenidate or amphetamine. Non-stimulants, clonidine is the most favorable in this type of disease. That is the monitoring checklist. Prognosis: Favorable factors, and these are the risk factors and adult persistence. Functional target, not simply less distracted but better daily performance. These are the main notes of this part. Improve sustained attention during reading, build reliable external system, treat comorbid condition that worsen attention. That is the integrated disease mechanism, risk factors, catecholamine dysregulation, network dysfunctioning, executive impairment, and clinical phenotype. These are the few factors that should be regulated uh, in disease mechanism, and while the physician is getting the history and the everyday condition of the patient, should note these aspects of the disease. Treatment improves function by strengthening attention control circuits and reducing environmental overload. Thanks and regards. Please like and subscribe this channel for further discussion on different diseases. Thanks and